Me so proud as mayor of this city is the way that we have stayed unified in the most trying and testing of times. It is our unity that has saved lives. It is our unity that has made progress. It is our unity that gives us better numbers than we would otherwise have. And I want to thank you, because that unity hasn't come from a mayor or from City Hall, hasn't come from elected officials. It has come from everyday citizens, Angelenos, who know that the best way we can care for each other is by doing just that, caring for each other, by taking individual actions that can ensure that this coronavirus stops its spread. And it is that spirit that will carry us into the next days and weeks and months ahead. So thank you for that. Our overarching goal remains a safer Los Angeles, full stop. For people who stay at home, for those who are at risk of dying, for those who need to work in these critical days, and for those who will return to work in months ahead. And we won't ever ignore people's suffering. While we will make decisions to save lives first and foremost always, guided by science, we also know how difficult this has been, economically, psychologically, and spiritually, how much we miss each other, our loved ones, how we want to hold one another, how we want to be together. And knowing that that suffering is going on guides me and my decisions every single day, even as I make the tough calls about what can open or what needs to be closed. I know the human cost of this, but I also know that taking steps the wrong way forward will be bad for our health and for our economy. It will kill more people and will shut everything down again. That is why these days are so important, why our actions have to be so thoughtful, and why we have to not make political decisions or just ones from our gut, but ones that are based in the advice that we are hearing and the indicators that we can measure, that science and medicine provides us, because we know that while numbers get better, the threat of this coronavirus is as dangerous today as it is the first day it arrived here in Los Angeles. So thank you again for all that you are doing. And I'm going to close tonight with a few important thoughts about what is guiding me as I make decisions in these days ahead with my fellow leaders across this county, state, and country. But first, let me begin, as I always do, with the data, the numbers you need to know. Today, the county reported 1,638 confirmed positive COVID-19 cases, the largest number that we've seen. This brings the total to 27,815. But as a percentage, it's a 6% increase, not the largest we've seen. This increase could be as much about our increased test capacity as spread. More tests equal more diagnosed cases, not necessarily quicker spread. We also know that these numbers come to us unevenly. Some days, especially right after the weekend or over the weekend, they're lower. Midweek, Tuesday, Wednesday, Thursday, it's often the highest numbers. That's why we average the 7 days of a week. And based on that metric, our average over the past 7 days has been about 1,000 new cases, 1,002 to be exact, over this past week. In the city, we had confirmed 943 new cases today, bringing our total in the city of Los Angeles to 13,468. That represents an 8% increase since yesterday. Again, that's a higher percentage increase, but it also could be the higher number of tests that we're doing in the city of LA as we've opened those tests up to people without symptoms as well. And today, one metric that doesn't change, that does not lie, the deaths that we have to announce, and the worst part of this evening, was 58 fallen Angelenos who we lost or learned that we had lost in the last 24 hours. This brings the total of our loved ones that we have lost in this fight to 1,313, a 5% increase since yesterday. We also averaged this out over 7 days, and by that measure, we've had about 45 people die, or that we find out have died, each 24-hour period of the last week. And our hearts break every single time. I don't even know what number address this is that I've given to you. Each night I've come before you, but I never want those numbers to overwhelm us or to desensitize us to families that are suffering and loved ones that we've lost. These are big, alarming numbers, But what we are witnessing is as much a reflection of detection, our scaled testing network, as it is spread. We simply have more information, and more information is good. It's good for us as we make decisions. It's good for us to know who people are who might not show symptoms but can spread this disease. So it's a double-edged sword. It may make us realize and sober us up about how tough the days are ahead and how constant this disease is in our lives and our city. It also encourages us about the work that we are doing to prevent lives from being lost as a result. And those numbers would be much, much higher if we hadn't taken the actions that we did, if you hadn't taken the actions that you are each day, of staying home, of social distancing, of washing our hands, of wearing your masks, of using your head to make sure that we all are frontline responders against this disease. And thank you through your actions for helping us keep our hospitals still below capacity. It's the most important measure we have. We saw in Northern Italy, we've seen in New York, hospitals come up to the point of their capacity and sometimes beyond. We've seen bodies in refrigerated units. We've seen decisions made in hallways about who lives and who dies. But here in Los Angeles, thank God we haven't seen that yet. And I hope that we never do through our continued work. And the numbers don't lie here either. In our general emergency hospitals, we have 1,281 beds that are available today, including 1,055 acute care beds, of which 226 are ICU beds, and an inventory of 1,331 available ventilators. We had 84 new admissions in our hospitals over the last 24 hours for COVID-19, and these numbers show a more stable number of hospital admissions. But remember, those cases overall remain high. And I just want to remind everybody, if you have a non-COVID emergency, if you feel a pain in your chest, you think you might be having a heart attack, a family member needs to see a doctor for an underlying health condition, you can and you should seek medical help. We don't want people avoiding hospitals in the midst of this. We don't want them dying unnecessarily because of fear of COVID-19 in the hospitals. I've seen it firsthand how well our hospitals are keeping patients with COVID-19 away from other parts of the hospital, and you need to look after your health. Don't let COVID-19 kill us because of secondary conditions or other conditions because of our fear. Now, I hope everybody knows by now in LA County, anyone can get a test, whether you're showing symptoms or not. And you can sign up at a place I've said probably 1,000 times in these briefings, coronavirus.lacity.org/testing. Or you can call during business hours 213-978-1028, or just call 311 after 5 p.m. There are 34 testing locations across the county, one close to you. That's always been our goal, to make sure you don't have to drive across town, that you can find something convenient. And today we have the capacity to test a whopping 18,500 people. By the end of today, we will have busted through testing more than 200,000 people since we stood up these centers. And remember, you can get tests through your providers and other places as well. While this is the bulk of the tests, together we think we've probably tested more than 250,000 people in the county. And starting tomorrow, we are extending hours, as I mentioned, but I wanted to remind you, at all of our testing sites to 5 p.m. to make it more convenient for you and to help with additional capacity. And one last reminder, the number tomorrow goes from 34 testing centers to 36 testing centers as we open up in Northridge and Baldwin Hill malls, a new drive-through facility in each of those locations to give people even more places to go close to where you are. You know, everywhere we look in this crisis, we see far too many of our neighbors, of our family members and friends and loved ones hurting, whether it's people struggling to pay the rent, folks who are suffering from domestic violence, workers, small business owners. But we also have seen tremendous generosity, Angelinos who are stepping up to help, to give their time, their resources, their love to one another. And here at City Hall, our job together with our Board of Supervisors and other city halls across this county is to marshal those volunteers into a united force, whether it's working in a food bank, whether it's in a new homeless shelter, whether it's folks who are visiting seniors to do wellness checks. This assistance in the midst of an emergency means everything. And tonight, along with our city attorney, Mike Feuer, I'm very proud to announce a new initiative. It's called LA Represents. It's an unprecedented pro bono, that means for free, initiative to provide legal services to Los Angeles residents who are facing hardships caused by COVID-19. LA Represents is a coalition of our top law firms, bar associations, and attorneys who are volunteering their services free of charge to the rest of us. Help vulnerable renters, help survivors of domestic violence, and low-income families and workers with everything from employment issues to debt and bankruptcy challenges. Because people are finding themselves in some of the most pressing and painful moments of their lives. These are complex situations, and we don't always all understand the law, those of us who are not lawyers. Having a lawyer and an advocate by your side can make all the difference between a positive outcome or a negative one. And on top of that work with individuals, LA Represents is starting a new support system for small businesses that have been devastated by this pandemic, led by the extraordinary team at Betzedek Legal Services. This is absolutely vital for small businesses to get back on their feet. Small businesses are the backbone of our economy. They are the mainstay of our main streets. They too often lack effective representation, and they right now may need sound legal advice to navigate new workplace rules or to renegotiate commercial leases, to apply for government loans that are available, and figure out how to best comply with our emergency health and safety orders. In a city that's built on the belief that everyone counts and that everybody deserves a shot, to every entrepreneur who's tried to stand up a business and now is trying to keep it afloat, LA Represents to them and to everyday Angelenos who need a little bit more help, that we are here to help with your struggles. Anyone unsure how to make ends meet, anyone worried about being left behind in this crisis, we see you, we hear you, and we are here to help you. And beyond Betzedek, let me thank a few other partners who helped us kick this off, that pursue every day and perform the work of justice for vulnerable and marginalized communities every day. The Legal Aid Foundation, Inner City Law Center, Public Counsel, Asian Americans Advancing Justice, and Neighborhood Legal Services, all extraordinary groups that every day, long before COVID-19, were helping average Angelenos navigate legal issues. And we're grateful to so many law firms who have joined us as well, too many to name here tonight. But let me give you a special thanks to LA Represents' talented leadership team of Jesse Kornberg, Eileen Decker, Diego Cartagena, Catherine Reisner, and our legal team here. I want to thank Jeff Millman from my team who has headed this up as well as the City Attorney's Office who's put this together. For those who want to learn more and who are interested in joining this cause, please find out that information, always that same homepage, coronavirus.lacity.org/LA Represents. And indeed, we do here in LA. Today is also Giving Tuesday. This is a local and a global response to COVID-19. And to those nonprofit and volunteer groups that are stepping up to help us here locally, around this country and around the world to navigate this crisis, to help those in need. That spirit of generosity has been on full display from the first moments of this crisis. And every day we learn of more individuals and families and companies and organizations who are doing their part. Companies like NBC Universal, which donated thousands of hospital items from their supply, like surgical masks and gloves, hospital gowns, scrubs, and shoe covers for medical workers. Companies like John Paul Mitchell Systems, which provided 16,000 gloves and 16,000 bottles of hand sanitizer to help us protect city employees. Thank you. Like Ring, Inc., who's the home security company that so many of us are familiar with, whose CEO, Jamie Siminoff, personally dropped off a donation of 100,000 masks today at our city's Emergency Operations Center. Thank you, Jamie. And organizations like Waves for Water, a humanitarian aid nonprofit that collaborated with the local startup Dine11 to launch the Help the Helpers campaign, an initiative that has activated 19 local restaurants here in LA to prepare and deliver more than 1,300 meals to frontline workers. And people like Veronica Sanchez Soto, who is a McDonald's franchise owner in downtown LA, who has twice donated breakfast for the first responders working at the Emergency Operations Center and handed out coupons for free meals for them to use later. And to everybody who's donated to the Mayor's Fund that's already helped thousands of families, given out millions of dollars in direct aid. And you can always visit, and every donation counts, at mayorsfundla.org. This is the best of who we are right now. I know it's the toughest moments we've ever faced, but it demonstrates who we are, our mettle, our character, our determination, our ganas in Spanish, the ability for us all to move forward and to say what we believe in and who we care for. We are now in a world that is so much more complex than just a few months ago. We're facing a virus that remains as dangerous to us today as it did when this started. This is not a world we wanted, that we expected, or that we asked for. And we didn't get to pick up the moments in our lives that we missed so much and that we had to leave behind. But we do get to decide how we will respond and what we will do. In Los Angeles, we are using science and statistics together with caring and compassion to lead our way. By keeping each other safe and protecting human lives, we're responding with LA love. This is hard and things will be hard for a while. I have to say it every night. While I want to encourage you, I also want you to hear the hard truths, that we will be in this for a long time, this year, in one way or another. There aren't hard openings and hard closures. It's going to be living in the gray in between the black and white that I know so many of us hunger for. But we will get through this fog together. I believe in you. I believe in us. I believe in LA, and I know that there are better days ahead. But before I close, as I said at the beginning, I want to answer the most important question on everyone's mind. What lies ahead as we begin to discuss reopening? And as I said last night, I hope later this week that cities' leaders, and I say that plurally from many cities around here, as well as our county leaders, can stand together as we did at the outset of this and talk about how we'll take those steps together. But there are a few main principles that guide me in the decisions that we are making in the days ahead. First, and to be clear, I want people to understand what the state says versus what your local leaders say. The state permits certain things, but it doesn't prescribe them. In other words, the state gives us the boundaries that we have to stay in between. But when people hear, or if anybody ever thinks that they read an article that says, oh, the state's opening up on Friday, what the state has said is local governments can decide starting from Friday how and when to open up with these guardrails. So Friday's the first day that can happen, but it's still up to local governments to assess what's it like on the ground, what are the conditions today, how can we do this safely? So the state permits, but it does not prescribe moving forward. Second, we cannot go too fast. You see it in polls across the country that people are much more worried about going too fast than too slow. But I know that there are people frustrated and strong and oftentimes loud voices saying, we want this now. But it's the worst thing for both our health and for those who say, what about my economic suffering? It's also the worst thing for our economy. You see, if we go too fast and we see cases go up and we see people begin to die in bigger numbers and we even see our hospital system overwhelmed, that's worse than going forward the right way, just a little bit slower. And that's going to guide me every single day when we have confidence to take moves, as we've done in the past few weeks, by the way. We've taken moves throughout this. It's not that May 15th is suddenly a brand new door. We have shown the ability to do things the right way when we do them correct and not just fast. Third, building on that, we have a proven track record and experience. We're learning lessons. As we try to learn more about this coronavirus, we're learning how to deal with it and live with it every single day. Two examples, construction, which we started with. When we learned early on that people weren't using PPE and stuff, we set up a system of inspections and inspectors, went to thousands of sites, and we're able to keep people's livelihood going, keep critical infrastructure moving while we kept people safe. Farmers markets was another great example. We had to shut them down temporarily because we saw people not practicing the safest measures that they could, but we then implemented working with them and the public ways that we could get fresh, good food, go outside to those familiar and beloved farmers markets in our neighborhoods and still be safe. So these experiences guide us moving forward. So that's the third pillar. And fourth, we have to do this together. I kind of wrapped this up where I started. This virus thrives on division. It thrives on political division. It thrives on geographic division. If we don't march together as much as possible, and we'll never be unanimous across this country, or across this region, or even within this county, but if we can strive as political leaders, as jurisdictions, and as the people who live here to be figuratively, if we can't literally, arm in arm, we will be better armed against this coronavirus. I support, for instance, work in the next few days and weeks to do some things to make life a little bit better for all of us. I'd like to see the reopening of some low-risk spaces and places like trails, some streets that we might be able to shut down so that we have a little bit more room to walk in. Some of the places that we've already heard announced from the county, for instance, about making sure our mothers can have flowers on Mother's Day. We can do this, but we must do this together. If we do this unevenly, we will fail. But if we do it together, I trust that we can and will succeed. So please continue doing everything together, wearing those masks. Don't be the 1 or 2% of people that aren't. Making sure we physically distance. Don't go out in a pack together or get together for a secret dinner that will spread coronavirus in your neighborhood. Continue to listen to our public health officials. And I want to thank again Dr. Ferrer, who I know is going through so much with 10 million people, the largest jurisdiction locally in the country, to make the decisions about how and when, balanced with the economic considerations and political considerations of unity that we have to do. But I'm confident that our extraordinary Board of Supervisors, that my fellow city leaders around LA County can do this and do it well in the coming days. We've all been doing our part, and I promise you I will never stop doing mine on your behalf, to make sure that we stay safe, that we stay healthy, and for now that we stay at home. Because when we do, we have that strength and love that will get us through this moment. And for that, I thank you. With that, I'm happy to answer questions for today. Thanks. First question, please.
The first question comes from the line of Robert Kovacic. Please go ahead.
Hey, Robert.
Good afternoon, Mayor Garcetti. Listen, let's talk specifically about flower marts since you mentioned them. Your message has been clear about how and when we're going to reopen, but every day we're seeing more businesses moving forward. And today we observed the flower mart in DTLA. There were shops that were open. There were people that were allowed inside despite the closed quarters. Are they operating with approval then? Are they being monitored? And are there ramifications if they're not?
Yes, yes, and yes. They are. As of today, we have given them permission to prepare for Mother's Day, one of the biggest days of the year. That is something that I think was something not only that we could pull off safely through our experience with farmers markets. Second, they are being monitored. We've got public health there, and we certainly will do inspections as well. And if people do not just a flower mart, any place that opens up, or people who aren't practicing safely, of course, we will, as we've done throughout this, educate, encourage, and enforce. So that is, as I said yesterday, with new freedoms come great responsibility, kind of paraphrasing Spider-Man, but that is how we can keep things open, by being smart. We know by now physical distancing is necessary. We know you have to wear PPE by now. And so we've updated our order for wholesale flowers to allow that to happen. I also think, as the governor has talked about, and whether we do it this week or more likely the following week, that curbside retail is something safer than what we're doing in our own supermarkets and pharmacies. And I know drugs and our or medicines and our food is absolutely critical. But I think that we can take those steps. But we will be laser focused on monitoring and hopefully, as I said, educating, encouraging, and if we need to, enforcing. Thanks, Robert. Don't forget to get your mother some flowers. All right, next.
Will do.
Thanks. Next question.
Next question comes from the line of Alex Michelson from Fox 11 News. Please go ahead.
Hey, Alex.
Hi, Mayor, and I appreciate the love for mothers. A shout out to my mother as
Yes.
well. On though this curbside issue, because there are going to be so many businesses that are going to want to reopen on Friday. They see other businesses around the state reopening with curbside. There'll be extraordinarily political pressure and anger if you guys still say people can't do this. What do you say to those people who may be seeing their neighbors being able to reopen if you tell them, no, you can't?
I'm sorry, we're not going to be moving on those things this Friday. As I said, the state permits that as the first day. But local areas, governments have to be really careful about how you do this. And it's not that we're starting the thinking yesterday when the governor announced. We've been talking with retailers, with small shop owners. We've been talking to big retailers. We've been talking to outdoor and indoor malls. We have to get this right, because you don't do any business a service by saying it's open. Look in other states where we've said, well, open movie theaters or restaurants. And the great majority of movie theaters and restaurants are saying, no, thank you. We're not ready to do that yet. And we want to make sure that we don't do something reckless and say, hey, we got out there a week or 2 weeks early just to score political points. Sorry, 3 or 4 weeks later, we got to shut you down because the cases are up. While we have some good trends, Los Angeles has 55% of the deaths in the state, and we're 25% of the population in this county. You know, California overall is better. Los Angeles still outpaces the country, but let's look at those numbers soberly and let's get it right. We're not a county of 9,000 people with a lot of people spaced out. We're a much denser place. So I will continue to get this right. I don't care about those criticisms, so I always listen to them, because sometimes there's kernels of truth, and I never let, whether somebody's shouting it or whether they're saying it in the nicest letter, I never don't listen to that content. But my guide won't be balancing who's yelling the most. It'll be listening closely to industry, who I trust, to tell me how to do this safely, running that by Dr. Ferrer, and taking the county guidance on this, because I think that's the only way we can do this responsibly. So, and I don't think people will look back and say a week or two difference was more important than getting it right. And we certainly still need some more days to make sure we get it right. Thanks, Alex. And way to get your mom in there. I'm glad you got that. Next question, please.
Next question comes from the line of Claudia Pesciota. Please go ahead.
Hey, Claudia.
Hi, I have a couple of questions about testing.
Yes.
Some people are telling me that they're waiting far more than 30 hours for results, so I'm wondering if anything is being done to speed that up. Also, I'm told at the Woodland Hills site today, where it was in the 90s, people were tossing their samples into large open drums that were filled, so I'm assuming those samples were sitting there in the sun and heat for a while. Perhaps this is happening at other testing sites. Is there any danger, do you think, that that would damage the samples and affect the results? Thank you.
Sure. On the second one, we've got medically trained professionals and work very closely with the lab, so I'll get back to you specifically. But we make sure that things like that don't happen, or that they adhere to whatever recommendations they give us. 30 hours, which is one of the best numbers in the country, was the average. So absolutely, you will continue to find cases that do take longer. Since the beginning of this, we've tried to make sure some of those cases, we get calls through the helpline all the time. We went to a call where somebody waited 10 days. We find those outliers, but the average still is 30 hours, which, most jurisdictions are still between 3 and 5 days. But every single day we try to speed that up. Every single day we work with our laboratories to see, and we've got different types of tests too. The ones in the drive-through centers are the 30-hour average, but you also have ones which are the nasal swabs. Those ones have to be picked up, sent to a lab that's not right here, and those usually do take a little bit longer, that we're working on for our senior care facilities, and also for some of the folks that are experiencing homelessness. We were back on Skid Row, had a record number of tests today, I think 145 in our pop-up center, and we still, I think we have 5 positives of more than 1,000 tests that we've done on people experiencing homelessness. So we're always guided by the scientists, we're guided by the medical folks. I have no evidence that anything in Woodland Hills or anywhere else was done improperly, but we'll follow up and get back to you specifically on that. Thanks, Claudia. Next question, please. I'll take the next question.
Next question comes from the line of Steve Gregory with KFI News. Please
Hey,
go
Steve.
ahead.
How you doing?
Hi, good evening, Mayor.
Good evening.
I wanted to ask real quick, first of all, you made an interesting comment about telling people not to have secret dinners. Do you have some sort of intel about people doing that? And I mean, what kind of even prompted you to think of that? Also, I wanted to ask you if you've had any more information about how the services are going on downtown with the makeshift nursing homes in the hotel downtown, or excuse me, the hospital downtown, and if you have any more information about how long the UNSNS Mercy is going to be here. Thank you, sir.
Sure. Let me work backwards. The most important thing that the Mercy, as much as it's been great to have a ship, should we have had to surge hospital beds and relieve non-COVID-19 patients to the ship, is the nurses and medical teams that are working in our senior care facilities now, senior nursing facilities. That's not just LA County, by the way, for everybody listening. In other counties like Orange County and in the region, these folks have gone out there. As I've mentioned, the city has 6 surge teams that go to senior nursing homes. We've been in and had tests or pending tests for more than half of all the ones that exist now, or in contact with the remainder, with a very small percentage left. We want to keep those teams here. So regardless of whether the ship stays, I don't have any information about timing, and know it's very expensive to keep it in port with everybody there. We really want the personnel at this point. Should we need a ship back, should we need that surge capacity, we know it's close by in San Diego, so I'm good with it whether it stays or goes, but I want to keep those strike teams that are really critical where the most people are dying, which is from our senior nursing facilities, responsible for about 40% of our deaths. In terms of the secret dinners, no, I think we just hear that anecdotally, and we get calls all the time. My neighbor's doing this, there's a party there, et cetera. I know some people kind of consider themselves of having a coronavirus bubble of friends, that you all kind of can hang together. We do not permit people to get together right now in the numbers that, 20, 30 people together. And we do not only not encourage that, we strongly discourage that. So it's more anecdotal and calls, and people have said, oh, I think my neighbors sound like they had a dinner party with 10 people. There will be days ahead where we can see each other again, where we will have protocols for that, but please use your good judgment. One night of fun isn't worth us all collectively 10 million staying in for another week or two, or a month. So we really want to make sure that people are adhering to that, and of course we always follow up when we get leads to make sure people aren't doing that. And then I think, I wanted to correct one other thing too, that I said of the number of people that have been tested by our test, it's 1,800 people experiencing homelessness that test, and now it's 17 positive. I gave you a number from yesterday with 5. So 17 out of 1,800 tests so far have come back positive for people experiencing homelessness. And I think I hit everything. Mercy, nursing homes, secret dinners. All right, thank you. Next question, please.
We have a question from the line of Elizabeth Cho from LA Daily News. Please go ahead.
Hi, Liz. How are you?
Hey, good. Hi, Mayor. I was wondering, I was wondering if you shared how much the per room cost was for the downtown LA hotel that's participating in Room Key, and also was wondering if you could talk a little bit about shelters getting more testing, shelters getting more testing, and why those shelters have been on a different track so far, potentially with getting testing from partnership with Everlywell, because there was a motion today by Councilman O'Farrell to expand testing at shelters, and I wanted to see how that idea aligns with what you have planned or what the county has planned, and those are the questions I have. Thanks.
Great. So working on the test first, absolutely supportive of that. We've tried to expand that. We've mostly done it in reaction to anybody that has symptoms, and we've successfully caught some people who were positive with COVID-19, been able to take them to a place to isolate where necessary, quarantine any people, but we haven't seen an explosion and spread in any of the city-run shelters that we have, which is good. As we have more capacity, absolutely. The Everlywell tests are also serving our senior nursing facilities, where we've seen an even greater danger. So we've put that, and the county has asked us to continue ramping up and helping them with senior nursing facilities. But as we build capacity, we've got in those shelters about 1,000 people right now. I think we've got, let me see if I have the exact number. 862 of the 1,036 beds. So that shouldn't be much of a problem for us to be able to do. It's just a matter of logistics. So I'm very supportive of that and appreciate Councilmember O'Farrell's doing that. In terms of we're not disclosing room prices. These things have to be negotiated. Over 800 hotels, as I've mentioned, that we called. But we're always trying to get the most value. And to that, where people are saying, hey, why not you put people up in this hotel or that hotel? Remember, Ritz-Carlton costs a lot more than other hotels, and we try to get the most people in for the amount of money we have. Everything costs something. And so I don't want to spend in the most expensive places or for the most amount of money for a symbolic win. I actually want material wins where people get into housing. Thanks, Liz. Next question. Oh, and sorry, we have 10 clinics for shelter testing right now that are working on that too. So some of the clinics that already interact with folks on the streets are helping us with that testing, not just the Everly Well. Next question, please.
And our next question comes from the line of Dakota Smith from LA Times. Please go ahead.
Hey, Dakota.
Good evening, Mayor. Just some questions about the Flower Mart.
Mm-hmm.
In terms of the Flower Mart being able to open, do flowers fall under a specific category of retail that's being allowed to open this week? And if so, what other businesses under that umbrella will also be allowed to open with restrictions? And if it's just flower shops that are being allowed to open, why flowers? And if it is just flowers, is that purely because of Mother's Day, or why flowers? Thank you.
Sure. It's actually under the agricultural permission of the state, which kind of farmers markets have also fit under. So it's only the wholesale distributors, and that's preparing for. We'll see. I'm going to follow the county's guidance on retail moving forward. Absolutely. I think part of it is that this is an area where we felt we actually saw some other flower marts that do wholesale open in other parts of the states and even this county. The big daddy is here downtown. People know the wholesale flower mart, and we thought that if those ones have stayed open, this one should be as well, especially coming up for Mother's Day, and especially because that's so critical for our flower industry on one of the biggest days of the year. But hold tight, that stuff, we're still awaiting county guidance on any more retail, but it's not retail, it's wholesale under the agricultural permission that's already there in the state. Next question, please.
And our last question from the night will be in Spanish and comes from Abel Emilio from Telemundo. Please go ahead.
Hey, Abel. Buenas tardes.
Regarding LA Represents, what are some of the qualifications to receive this help, and would the undocumented community be able to benefit from this?
Absolutely. LA Represents, there are no qualifications. You just need to have a problem that you need assistance with. It is without discrimination in terms of immigrant, non-immigrant, whatever your immigration status is, age, ethnicity. This is available to everybody who is a resident of Los Angeles. So without any fear, without any discrimination, this is universal. La programa de LA Protects, y yo tengo más palabras de ese programa en un momento, es por toda la gente. Inmigrantes, sin papeles, con papeles, todos los raíces, los residentes, en cualquier vecindario de Los Ángeles, es universal por toda la gente. So again, I want to thank